Welcome, grasshoppers, and happy Thanksgiving coming up. We've got anaphylaxis on the plate for today. Going to ram through this pretty quickly. I got the worksheet that's below these videos that you can pull the worksheet up and fill that worksheet out as we go along here. I'm going to talk about anaphylaxis and how that happens. And first, we need to do some descriptions. An antigen is a substance that forms antibodies that comes into your body. It can be injected in, you can ingest it by mouth, you can inhale it, or it can get absorbed through the skin, but an antigen is the bad guy. Once the bad guy does get in, you really have three lines of defense. Obviously, the skin is going to keep the bad guy out, so that's your first line of defense, and then you've got an inflammatory response, which is the primary response, and an immune response to deal with this invading bad guy. If that invading bad guy, which we're calling an antigen, becomes an allergic reaction, that antigen is now referred to as an allergen. And your body is going to try to create antibodies to fight that specific antigen off. And it's going to do that through proteins. They act as antibodies, which we will call immunoglobulins. So the concept of an immune system protein, an antibody, and an immunoglobulin, we're all going to call that the same thing. So an immunoglobulin, abbreviated Ig, and a protein in the immune system and an antibody are all the same exact thing. So even though we use different words, it means the same thing. So here comes the bad guy. Intruder alert, intruder alert. And then we get a primary response as this guy comes in. The cells inside your body will greet this intruder, confront it, surround the invader, ask for its passport, which has all its DNA makeup on it. It'll recognize it. If it recognizes it, it'll let it in, no problem. If it doesn't recognize it, it's going to create a file. It's going to take a mug shot, and it's going to send out wanted posters throughout the body. And then the body's going to see that, and it's going to take that DNA, and it's going to make antibodies where it hits again. So there's the posters going out. Who's it go to? Well, it sends it out to the police officers. The police officers in the body are the basophils, which will also called granulocytes, and in essence, they're white blood cells that sit in the body, in the skin and the mucosa, and they wait for these bad guys to come in, and they're the police officers that are going to deal with them. If they're bad guys, they'll kill them. If they're not bad guys, they'll let them go. Mast cells act very similar to the way basophils exist, the way basophils work, sit inside the connective tissue. So together, those basophils and mast cells have with them, because they're the police officers, have with them chemical weapons, or mediators is what we'll call them in the medical world, mediators, and they have chemical weapons inside of them, and the primary one is histamine. So as this invading organism comes in, the antibodies with their chemical weapons release the mediators. More white blood cells are called in to defend, and then as these mast cells get hooked up with the antigen, as you see here, here's the antigen, and it gets placed on the surface of the mast cell, that activates the mast cell and then releases its chemical weapon called histamine. That histamine is going to cause two primary things going wrong with the blood, especially if there's an over-release of them, which is what happens in anaphylaxis. More blood is called in. That results in vasodilation and capillary permeability. I have a video on the next series of videos that explains that a little bit better, and you can see it a little bit better, but we get vasodilation and capillary permeability, and the blood leaks out of the blood vessel, and the white blood cells that are inside of here start heading towards where that bad invading organism is to try to fight it. So as we've said, histamine results in increased vascular permeability and vasodilation, which is going to result in a lowered blood pressure. You're going to get a reduced volume of that vessel, reduced preload, and you're going to get some symptoms like urticaria, which we call hives. Again, more on that coming up in the next slide set after this. But the big thing here is to keep in mind is the increased permeability, where what that means is that there's the stuff that's inside your vessel can get released much easier, and capillary and venous dilation, vasodilation, that's going to result in a lower blood pressure. The result, As those histamines and chemical weapons and things like that head towards the invading organism, wherever that happens to be, you're going to get some swelling. So as the invading organism, let's say if it's a bee sting, it gets into your blood and starts to circulate throughout your entire body. So you're going to get swelling all throughout your body. You're going to get it all across your skin, and you're going to get some hives as that fluid moves towards the body. If it's in the face, we call that angioedema, and I think you can see the obvious problem here, and that is our number one concern, airway. So we get swelling of the tongue, the face, and the lips. We have B lymphocytes and T lymphocytes that are going to help with this secondary response of the immune system. Again, so far everything was the inflammatory response. Now we get to the secondary response, which is the immune system. There are B lymphocytes that sit and mature in bone marrow, and the way we remember that is B lymphocytes, bone marrow. And then there's T lymphocytes, and they mature and sit in the thymus, and that's how we remember that. T lymphocytes sit inside the thymus, which is a gland that sits behind the sternum. So we've got B lymphocytes and T lymphocytes. B lymphocytes produce antibodies, and I'll explain what that means here in a little bit. T lymphocytes do not produce antibodies, and quite frankly, we're not going to go that deep into anything else regarding T lymphocytes at this point in time. We're just going to stay with B lymphocytes because this is more prominent in an allergic reaction that we're going to see, like a bee sting or a peanut allergy. Other ways in which we get immunity is we get acquired immunity, where we do vaccines, and these vaccines produce antibodies so we don't get the disease. Or you get the disease, and that disease produces the antibodies, so it can get rid of it. Either way, acquired versus natural immunity. As promised, I told you what an antibody would look like, and what you see on the screen here is an antibody. These are produced by B lymphocytes, which, if you remember, sit and mature inside the bone marrow throughout our body. And what it does is that invading organism that's coming in, and we talked about it, zzz, boom, and it latches right onto here, just like a magnet. It latches right onto here, activates this chemical weapon inside this antibody, and then releases that chemical weapon to the body. That primary chemical weapon is histamine. The histamine spreads throughout the body, vasodilates, causes swelling, but allows that chemical weapons, those white blood cells, to get to the invading organism, eat it up, and kill it. Proteins, immunoglobulins, antibodies, all the same thing. Immunoglobulins are proteins that act like antibodies. All antibodies are immunoglobulins. For just the sake of argument, all immunoglobulins are antibodies. They're all proteins. They're all used together, and there's a whole bunch of different classes of immunoglobulins. As you see here, Ig is the immunoglobulin, and they're, if you remember, gamed, G-A-M-E and D, and of all of those 5, there's only one we really care anything about, and that's IgE immunoglobulins. And the reason we care about that is because those are the ones that result in anaphylaxis, and that's what matters to us as medics. For an example, an IgA or an IgD may be a poison ivy or something like that. It's not a crisis, it's not an emergent thing, but an IgE immunoglobulin response and its release of histamine will create an allergic reaction big enough throughout the entire body that results in anaphylactic shock, and that's why it's a big deal. And these are found in mast cells. The danger, if it's a small area of attack, no big deal. You get a little swelling associated with that. You may get some hives right around there. That's not a problem. It's when it goes into the blood supply and then spreads throughout the body. And now you get whole body attack, and that's called a systemic attack and anaphylaxis. So just a small area, no biggie. Gets in the bloodstream, spreads around, releases histamine throughout the entire body. Now you've got an anaphylactic reaction in somebody that's going to die. So let's talk anaphylaxis. It's Greek, means opposite of protection. About 400 to 800 deaths per year with a 3% mortality rate regarding anaphylaxis. A whole bunch of causes of anaphylaxis. The biggest one that we're going to encounter as medics are bees. And I have double-starred peanuts because that has been a source of some really severe anaphylactic reactions as of late, particularly in school settings. So you may get dispatched to a school setting for a peanut allergy, and there are some of those peanut allergies that are now resulting in anaphylactic shock and become life-threatening. Schools have taken a pretty good answer to that by not having peanuts in and around. The schools widely have stayed away from that, and because of that, the call volume has gone down. But these things do still exist, and you'll see them at parties and things like that where they're not as on it at keeping peanuts away from these folks that have these types of anaphylactic reactions. Let's hit the bee sting, which is far more common for the everyday event, especially in fall. You get stung for the first time. If you get stung for the first time, you can't have an anaphylactic reaction because you haven't produced any antibodies that create the chemical weapons. IgE antibodies need to be produced. The IgE antibodies leave the lymphatic system. They bind to the basophils in the blood and bind to the mast cells in the tissue, and then they just lay there. They just lay there dormant until they get stung again. When they get stung again, then you get an overreaction of the release of histamine, and it causes even more vasodilation, and your blood pressure drops significantly, which can kill you, or closes your airway up, which can kill you. So that's what I've got this chart here for. It's a release of histamine from the mast cells. The histamine release causes two life-threatening problems: a bronchospasm, which results in hypoxia, shock, and you could die. Or the histamine gets released, it results in vasodilation, hypovolemia, hypovolemic shock because it's a space issue, reduced cardiac output, and you go into shock, and you could die. So it's either way. You can die from airway closure, or you can die from vasodilation. The biggest of those, the most threatening of those, is the vasodilation. That's the one that kills people most and most often, and bee stings and peanut allergies are the common in the EMS world that we're going to encounter today. A lot of things mimic anaphylaxis, so don't be fooled by other things. Sometimes they're wheezing, they're panicked, and that kind of stuff. It could be an asthma attack, it could be septic shock, it could be a variety of other things. But just say that there are other conditions out there that kind of give the same presentation that this does. A primary assessment, we're looking for voice changes, a barking cough, high-pitched stridor or throat tightness. All of those things would result in a need to call ALS immediately. And we're going to need to manage that. The ALS is going to need to manage that aggressively. For the next series of slides, there's some. I'm going to look at each of the body systems, and I'm going to give you the primary results from an anaphylactic reaction. There are others listed there. Please feel free to go through the PowerPoint to get that. But the respiratory is going to lead to bronchospasm. Cardiovascularly, we're going to have vasodilation. And from a GI system, we're going to have abdominal cramps, and that's one of the first symptoms we get with anaphylaxis is abdominal cramps. That's the first one we see, and it could have nausea and vomiting. Anxiety from the neurological side of things, or we're going to get hives, and the medical term for hives is urticaria. Urticaria is a series of patchiness, and that's where all of this histamine gets released to the surface of the skin, so you can see it right there. Or some of that fluid that's coming out of the cells gets in these raised bumps called wheals. W-H-E-A, a wheal is a raised bump. We talked about angioedema and tearing of the eyes as well along that. These things typically occur within 30 minutes after the insult of the injury. There usually is a history of some previous exposure with some type of anaphylactic reaction, and we need to gather some medical history to see if there's anything else that's going on. Our treatment of choice, as described in a video that's coming up, if somebody gets stung by a bee, ABCs, high flow oxygen, remove those stingers, usually done by tape. I'll talk a little bit about that when we get back to class. And our drug of choice is going to be epinephrine. It's a vasoconstrictor, which corrects that vasodilation, and it's a bronchodilator, which corrects that bronchoconstriction, and it's an EpiPen that will be used, and that also is coming up in a video in a little bit. Okay, thank you very much. That's anaphylaxis, all in a 15-minute time frame. Watch the next two videos for some additional information. Complete the worksheet. We'll see you next week. Thanks. Bye.